Good morning, everyone. Thank you for joining us here today, and thank you as well to Dr. Roussin, our Chief Provincial Public Health Officer, and Dr. Mateer, who's a new face on the team. He's the Health System Co-Lead for the Unified Health Sector Incident Command. Thank you both for being here. Our government is continually consulting with public health officials who closely monitor COVID-19 data. Today, we're announcing that public health orders currently in place will continue for one additional week. They will continue to 12:01 a.m. on Tuesday, February 8th. Manitoba will remain at the orange restricted level under the pandemic response system. Our government, along with public health, continue to assess the spread and impact of the Omicron variant. However, we're seeing early signs of stabilization and positive indicators that COVID-19 is stabilizing in our province. Rate of hospitalization appears to be plateauing. However, rate of ICU occupancy does not appear that way at this time. And I'll ask Dr. Roussin to speak more about the data in a moment. Extending the public health orders by 1 week allows us time to confirm the trend in the COVID-19 data and its impacts on our health system. We must continue to take steps to help our health system through this pandemic. We need to ensure that we continue to have hospital beds and staff available to provide care for patients in need. And I just want to give you a bit of an update on the staffing within our health system and to congratulate some of our nurses that are graduating from our critical care nursing program. This month, there will be 23 nurses completing the 12-week critical care training program. And over the last year, over 150 nurses have completed the Critical Care General Orientation Program, which will help support our ICUs. The next 12-week program is scheduled to start on February 7th, and 30 nurses have signed up for that program. Dr. Mateer is here today to discuss the impacts of COVID-19 on our health system, and he will have an opportunity to do that after Dr. Roussin speaks. I'll now pass it over to Dr. Roussin to provide information on our data.
Good morning. Thank you, Minister. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'd like to welcome Dr. Mateer to Incident Command. As we continue to navigate Manitoba's response to the pandemic, we still have a lot of important work to do in the coming weeks. So building on the Minister's comments, we are nearing a critical juncture again. Based on several data points, it appears that Omicron wave may have peaked or is in the process of peaking or plateauing in Manitoba. So there's still a significant spread of Omicron in our community, and so certainly the healthcare system are feeling those effects, although there's some indicators showing that some of that may be stabilizing. Wastewater testing shows we still have relatively high but stable viral transmission in the communities. Test positivity rates, we've discussed some of the limitations, especially with our testing strategy now, and those are remaining high, around 30%. And as we discussed earlier in the week, many of these indicators are starting to point in the right direction for Manitoba. So we always knew from when we presented the initial modeling that showed the spike of cases that would result from Omicron that we'd eventually reach a spike or plateau. And it seems like some of these indicators are indicating that that's where we are or soon approaching. So again, to reiterate, this is why at this point we're extending the public health orders. We are seeing some indicators of that plateau, but we need to look further at this data, have some more time to see these trends so that we can, again, make better informed decisions about these public health orders. So the week may not seem like a lot of time, but at the juncture we're in, it's going to provide us likely with significant more information. So we still have to be mindful that many people's lives and activities are still changed over the last few weeks. We know people have returned to school and work after holiday season, so that could have an impact on transmission as well. And then obviously we're still learning about Omicron and its transmission. So I do have a couple slides here just on our modeling that I wanted to present, just to give a bit of a picture of what we've been looking at. So we can go to the first slide. And on this is our modeling of hospital admissions. And so you can see that, of course, with all these, there's always a range of scenarios, but we're looking at being at a peak or plateau at this point or the near future, and then that slow downward trend. And again, another week of data is going to give us even more information, more clarity as to where we are. And if we look at the next slide, again, the ICU has always been that point where we get very concerned about capacity that has the most intensive capacity requirements on the healthcare system. And we can see there that we're expecting that peak or plateau in the near future. And so again, another week of data and review of our the information is going to give us a bit more clarity on both of these things. So, so this is that critical time for public health, and so we need more time to be able to make a clear decision based on this modeling. So in the week ahead, I still encourage all Manitobans to stay the course, keep doing what we've been doing, get vaccinated as soon as you become eligible for any of the doses. Practice the fundamentals. Again, if you are symptomatic, even mild symptoms, do isolate. If you are at high risk over age 40, if you have any underlying medical problems, if you're unvaccinated, get tested as soon as possible. Because we do have treatment options now available, but they do have a very tight window of effectiveness. So we need to diagnose very early, get treatment very early, and we have another tool to prevent further strain on our system. So again, thank you, and I'm going to pass it over to Dr. Mateer.
Thanks a lot, Brent, and good morning, everyone. My name is David Mateer, and I'm the Incident Commander for the Manitoba's response to the COVID-19 during this wave. I'm honoured to be serving in this capacity as Manitoba continues its pandemic response that has now lasted almost 2 years. We continue to see high numbers of COVID-positive patients in hospital due to significant transmission of the virus in our communities. There were 714 COVID-positive patients in hospital today, which is up 3 from yesterday. The good news is that these numbers have started to flatten out this week, which is a very welcome development. However, we continue to see high rates of new admissions to ICU of COVID-positive patients, including 9 yesterday and 39 in the past week. As of midnight, there were 110 adult patients in ICU. This number includes patients receiving both COVID and non-COVID care. This number is well above the normal levels and places strained on our staff and hospital system. As a reminder, the pre-COVID baseline capacity for Manitoba's adult critical care program was 72 patients. Of the 110 patients in ICU this morning, 54 were COVID positive. Our medical, operations, and planning leads continue to monitor the ICU and overall hospitalization trends very closely and have contingency plans ready if conditions escalate. Increased levels of community spread of COVID have affected both our patient population and our healthcare staff. So we see increased patient demand, as we're also continuing to see a diminished workforce due to isolation and illness. We wish all healthcare staff who are currently off work a full and speedy recovery. As has been presented previously, we'll demonstrate the impact of the data from Winnipeg Health Region, where sick time was equivalent to 8.6% of all worked hours in the 2-week period ending Wednesday. This is a significant improvement from the previous pay period, where the equivalent of 10% or over 10% of worked hours per week were lost to sick time. While this news could be seen as encouraging for all sorts of reasons, I want to caution that there is still a long road back to normal. While hours lost per week went down, a percentage of all hours worked, we continue to see small increases in the raw numbers over the past 14 days. The number of hours lost amounted to equivalent of 77,000 hours, which is up nearly 3,700 hours per week from the previous pay period. Sick time for this pay period is also up 70% from the same 2-week cycle in January 2020, when hours lost were equivalent to 6.3% of all hours worked. To give context, nearly 4,000 more 8-hour shifts were lost per week in this most recent pay period than during the same period 2 years ago. This level of sick time is obviously challenging from our workforce, just as it's undoubtedly challenging for the workforces in other sectors. The health system is working to support staffing needs in the most impacted and most urgent areas, including deploying casual staff to work in personal care homes experiencing outbreak. Redeployment and reassignment of staff from areas that can have services temporarily postponed is also underway. And that will impact some home care services, elective surgeries, and some clinics. We continue to recruit and train staff to support necessary and valued work in critical care units and personal care homes, with, as you've heard, 23 nurses scheduled to complete the 12-week critical care nursing orientation program in the next few days. Upon graduation from this course, these nurses will assume positions in ICU sites in Winnipeg and Brandon, bolstering staffing supports in those units in the weeks ahead. Another 30 nurses have signed up for the next 12-week class, which of course gets underway, as I think you heard earlier, on February 7th. Meanwhile, the Uncertified Healthcare Aide Micro-Credential course offered by Red River College Polytechnic and Assiniboine College continues producing staffing supports at personal care homes throughout the province. Approximately 50 courses have been delivered by Red River College Polytechnic since November 2020, including 6 that are running this month. Our provincial redeployment and recruitment team is working to redeploy existing staff to areas and sites in need of staffing resources, while also expediting hiring of staff into COVID-19 resource pools. Since the start of December, 167 existing staff were redeployed from the resource pool. In the past week alone, 33 staff were deployed to assist at personal care homes in the province. In addition to these efforts, financial incentives are also being offered to eligible staff in exchange for planned vacation over the next few weeks of this wave. While we recognize the importance of time away from work, we appreciate the willingness of some staff to consider rescheduling their time away in exchange for vacation at a later date and overtime rates for working when they would have been on vacation. The system also continues to make some necessary patient moves to ensure Manitobans continue to access care in our most specialized healthcare facilities. This requires some patients to be transferred for ongoing care to a hospital outside of their home health region. And while we recognize the concerns of affected patients and their families about the distance from loved ones, we also appreciate their understanding that these transfers are necessary. The interregional transfer protocol has resulted in 253 stable patients being transferred to sites outside of their home health region in the past 3 months, and that includes 39 in the past week. As a reminder, patients identified for transfer are assessed by a clinical team and matched to sites that can provide appropriate levels of care and that meet their needs. We're also continuing to admit to the Virtual COVID Outpatient Program, or VCOP. This program continues to provide home care to patients with COVID to help those who may require home oxygen and/or support during their recovery. To date, the programme has cared for 478 patients, including 20 patients currently, and saved approximately 3,300 inpatient days in hospital. The VCOP gives patients a safe alternative that allows them to be cared for remotely at home while freeing up hospital and staffing resources to care for inpatients. Our health system continues to navigate many challenges during this fourth wave. The speed and spread of Omicron are unlike anything we saw in the past waves. And they've required swift decision-making and some reductions in services that we didn't really want to have to make. As we look at the likely trajectory of the virus, there are a few things that we want to highlight. One, the moves that we've made have allowed us to maintain capacity during a period of unprecedented staff illness and isolation. These moves do not come without a cost. Staff are tired, and non-COVID patients have once again been affected. However, we have again increased the ICU capacity to far beyond the pre-pandemic baseline. Thanks in part to the 93 ICU nurses we've trained since last June, our health system can support the operation of 123 beds while reducing the impact on other services such as surgery. Of course, contingency planning is ongoing to identify next steps if patient demand increases. We continue to have some capacity in medicine, with approximately 1,480 beds available for use, of which roughly 182 were open last night. We've acknowledged that the location of these open beds does not necessarily line up with our patient demand, and that's something we're addressing in our inter-regional moves to ensure we have capacity. Two, we're seeing further evidence of the effectiveness of vaccines, and particularly the third dose, which is demonstrating its success in preventing the most severe illness and hospitalization. Vaccinated patients who do require care in hospital generally don't require care in ICUs, and if they do, their stay is generally shorter. Three, we have available treatments for those Manitobans who are not vaccinated and who contract COVID-19. We're also making these treatments available to fully vaccinated Manitobans with other risk factors for serious illness. These are significant developments, and Manitoba has moved swiftly to make these treatments available. And finally, I can't end without a sincere recognition of the ongoing and incredible efforts of Manitoba's healthcare workers, who after 2 years of direct care engagement on the front lines, demonstrate their commitment to Manitobans, their compassion for the ill, frail, and elderly, and their patience with those patients who require some extra information before getting vaccinated. I can't begin to express the appreciation that I feel personally, and that I know that our health system leaders feel, and that all Manitobans should feel for your efforts. I also want to acknowledge those healthcare workers who have stepped up into a role in the incident command to be able to address these challenges in an emergency management role. Thank you, and I'll now turn it back to the Minister.
Thank you, Dr. Mateer, and thank you, Dr. Roussin. As the doctors have stated, we're seeing some positive trends in the data throughout the province. But I also, each time I come out, remind Manitobans to please do your part and not only get vaccinated, your first and your second doses, but practice the fundamentals as well. Washing your hands, staying home if you're ill, practicing social distancing. And I want to thank the over 87% of Manitobans 18 and older who've been immunized with at least 2 doses, and to those who made the choice to protect the nearly 70,000 Manitoba children with a dose of the vaccine. There are over 2,000 vaccination appointments booked today, and our province has administered over 2.7 million doses to date. What we know is that vaccinations work. So please, get vaccinated, your first, your second, and your third dose. And I want to emphasize the importance of getting your third dose, and to just add to what Dr. Mateer has said, it decreases the risk of needing ICU care by 139 times compared to someone who is unvaccinated. Manitobans need to continue with the fundamentals again. Stay home when you're sick, wear a mask, continue to social distance. As we all learn to live with the virus, it is critical that we stay the course over the next week. There are signs of stabilization, but we need more data to fully assess our next steps and implement initiatives that support our pandemic response. Now, this is not to say that we're out of the woods, not at all, but there is light at the end of the tunnel. Next week, Premier Stephenson and Dr. Roussin will provide Manitobans with public health orders moving forward, including what I hope will be an outline to reopen the province. At that time, the Premier will also give details about extending support to businesses, the arts community, and the cultural sectors that have been so greatly impacted by this pandemic. Thank you again for joining us today, and we look forward to your questions.
Dr. Roussin, I asked you on Wednesday, and hopefully you know more today, or perhaps Dr. Mateer. How many of our ICU and other serious cases are Delta versus Omicron? And the reason I ask that, because the people who knew there was still the more severe Delta causing these hospitalizations, they might take it more seriously. So what do we know about Delta versus Omicron cases?
So I don't know if there has been any updates on that proportion. We have day-to-day turnover in the ICU, so we'll look for that. I haven't seen an update on what that proportion is.
I think it was said 110 adult patients are in ICU. Do we know how many children?
There are 6, so we have a
There's
total of
6,
117.
Pardon me?
6.
6?
That gets us to the total of 117.
Minister Gordon, we talked a little bit today about this unprecedented staffing situation that we're facing here in Manitoba hospitals. You know, over the last few years, the number of violence and abuse incidents or reports against nurses in Winnipeg hospitals has peaked to 559 in 2021. You know, what's your government's response to the fact that nurses and staff in Winnipeg hospitals are seeing more abuse and violence than ever before in the past 10 years?
It really saddens me, to be honest, and it's unacceptable. I was also seeing reports by Doctors Manitoba of what physicians are also experiencing, and I said the same. It's unacceptable. We need to look at ways to mitigate that. I'm very committed to working with Darlene Jackson, who's the president of the Manitoba Nurses Union, to look at ways that we can eradicate that. It is totally unacceptable, and we want our healthcare workers, our nursing staff, our physicians to feel safe when they come to work and as they move throughout the community. So that saddens me, and I definitely would like to look at ways to resolve that.
Does the government have any firm ideas to how widely the virus is spreading now, given the fact that we're still preventing most people from going for a PCR test? So do you feel comfortable extending the status quo, given that we've lost track of how many people out there have this?
Well, with Omicron, it's forced us to change our approach, right? So we know that there's widespread transmission. We don't need PCR testing to tell us that. So you're right. It's one indicator that everyone is very used to seeing, and things like test positivity. But we know from wastewater, we know from absenteeism reports, we know there's widespread transmission. We can look at those data to see what's starting to show that plateau and potentially downward trend in some of those indicators there. The testing, we needed to shift our approach to testing for mostly the purpose to treat. So we want people to be able to be tested early on if they're at risk, if they're unvaccinated, so they could have access to that treatment. So rapid testing still, if an individual tests positive on the rapid test, they can still access treatment. They'll have to confirm that with a healthcare provider there. But so really that shift is towards that test in order to treat. And then we have other indicators that we continue to follow and are modeling. So those are all looking like an early plateau.
And
On that
the
bit-
the lagging indicator of intensive care beds is still increasing. We're not quite at the peak we saw in the spring. How close are we to maximum capacity? Because if we're at 117 and that includes 6 neonatal beds, how close are we to having ICUs overrun?
Perhaps I could add to information to answer that question. We have in our incident command structure a planning section that is looking at the capacity of hospitals, ensuring that we plan to increase capacity in our acute care facilities to match the modeling that Dr. Roustan went into earlier. You mentioned that the lagging, perhaps occupancy at the hospitals after admission to hospital, lagging occupancy of ICUs after admission numbers to ICUs, and all of these pieces of information are taken into account as we plan for increasing numbers according to the modeling, and we have contingencies built into that as well. So we're already looking at potentially increasing ICU numbers as and when necessary, but we're taking our guidance from the modeling from public health.
Can you tell us how many surgeries have been canceled in the last month to accommodate COVID patients in hospital?
There have been surgeries cancelled at a number of sites in order to redeploy staff to maintain acute care capacity and more specifically ICU capacity. I can't give you an exact number on those at this point in time.
Dr. Mateer, if you had to scale up to 123 ICU beds, what would be lost? What services would be cut to get to that number?
What we have to do is compromise really in terms of our ability to scale up to deal with the capacity that's required. And that would then impact services that are elective in nature, clinics potentially, home health services perhaps, and some of those that are not essential services in order for us to be able to supply acute care services as it were required, and also to be able to provide the most essential ICU services.
I also wondered, you said that hospitalizations seem to be leveling out, but they're still quite high. So I'm wondering how long the system can sustain 30, 40 new patients per day just for COVID.
As was explained, the transmission in community is very high. Therefore, we're seeing high admissions to hospital. We are planning for accommodation and capacity to ensure that we have space for additional admissions into hospital and ICU. And we will continue to plan in accordance with the modeling and also the numbers that we're experiencing. So we will continue to plan for the eventualities that we have, where we have to deliver care for the population in whatever environment that would be, whether it be in acute care or whether it's in intensive care units. So we will continue to supply those services.
Minister Gordon, the one thing that I just wanted to touch on again is this nurse safety situation. You know, both the opposition NDP and the Manitoba Union of Nurses say that these patients are lashing out at frontline service providers like nurses, frontline staff, because they're dealing with a healthcare system that's failing them. You know, how is the government hoping to make the system one where people feel like they're actually being served properly and not frustrated anymore? Like, what's being done to address that problem?
So I don't have access to the study that you refer to, and that would be helpful in terms of knowing what the study found and the evidence that goes along with it. But always open to having discussions. I've had a couple with Darlene Jackson, the president of the Manitoba Nurses Union, and always open to meeting with stakeholders and even nurses to talk about what is happening on the front lines and looking at innovative and creative approaches to addressing it. Again, it's never acceptable to lash out, threaten a healthcare worker, protest outside of our hospitals and block patients from accessing care or making anyone feel any type of threat in the workplace. And we have respectful workplace policies, and I am very much in support of using those policies to ensure the safety of our healthcare workers. So it's not something that I'm aware of in terms of the study, but most definitely open to looking at ways that we can address it.
Dr. Mateer, we saw back in the spring, the third week of May, once we got to 131 patients in ICU, then that's when patients began to get transferred out. We're not there yet, but we have a different situation with a more fatigued staff. So what is different now? What are you doing differently in your scaling up plans for ICU that we didn't do, we being Manitoba, back in the third wave?
Well, there are a number of initiatives that currently are being undertaken. First of all, we're planning proactively for increasing the number of ICU beds. Secondly, the numbers of staff that you heard that are being trained to support ICU capacity is already in place, and we've seen the product of that. So 23 nurses graduating from that 12-week critical care program, making a total of 93, another 151 general critical care course graduates supporting that. So we have a number of staff coming in to support critical care capacity that we're building on as time goes on. So that picture is changing, in addition to the nurses that are being redeployed within the system. So the capacity, as far as staff is concerned, to support ICU is potentially better than it's been. The planning, we're learning as we go. So wave 2 we learned from, wave 3 we've learned from, and we're planning, for increases in ICU beds that would coincide with the modeling that we're seeing now. So I think the planning is better informed, and the staffing, we're better prepared for that in terms of ICU capacity.
One more in the room.
Are you confident that you're not going to have to ship patients out of province this time?
From our perspective, the health system is planning to accommodate the needs of Manitobans within the Manitoban healthcare system. That's what we're planning for right now.
We'll go to the phone.
Thank you. A reminder to our reporters on this Zoom session, you will have one preliminary and one follow-up question. Up first this morning from CHVN, Taylor.
Hi, I know we're looking at hospitalizations and intensive care, still continue to be really strained. Can you just explain the reasoning behind the possibility of a reopening plan?
Well,
I could,
sorry.
I could say from the perspective of the incident command structure currently, that's an ongoing activity. And what we are doing is continually, as we're planning to address the emergency of COVID in this wave, we're already planning for reopening. And what we will do is take our cues from it as an incident command from the public health modeling and the public health orders that I think Dr. Roussin is going to comment on. Thank you.
Yeah, I think we all realize that the public health measures, the public health restrictions are always intended to be temporary for as long as needed. So we should all never be surprised to hear that there's going to be a reopening plan. So we definitely plan to reopen Manitoba. We certainly are going to do so in a safe manner. That's why we've extended the orders for a week to give us a bit more clear of a picture. But absolutely, we are going to plan to reopen Manitoba.
Thanks. And can you say how long the average Omicron hospital stay is compared to, Delta or the other variants?
I could comment, but Dr. Roussin will probably add some detail to it. But certainly the length of stay for Omicron is less than we've seen for Delta. And so we're seeing that in hospitalizations. We see that in the VCOP program. We're seeing that in ICUs. We're seeing that as a positive sign. But I think Dr. Roussin maybe could add a little bit more detail around the science behind that.
Yeah, I think that we've seen Omicron is acting different than many of the other strains, much more infectious, overall, less severity, but of course still causing a strain in the healthcare system just because of the sheer numbers of people being infected. So one of the things that we are seeing is that decreased length of stay, especially in those that are vaccinated.
From Global News, Rosanna.
Good morning. What has the province's conversation about third doses looked like with the federal government in terms of making third doses the standard for fully vaxxed for those eligible?
To my knowledge, that conversation has not been held to date. It is my understanding that the requirements to be fully vaccinated are still 2 doses. Of course, we always are paying attention to the National Advisory Council on Immunization and their direction, but at this point, fully vaccinated is 2 doses.
Great, thank you. BC is saying vaccine cards will be in place until at least June 30th, and I know, Dr. Roussin, you touched on this on Wednesday, but with Omicron being so widespread, however, can you give us a timeline as to when that might end, as well as mandatory masking?
So again, we're going to have more to come on our reopening plans. I think all of the measures that we've used were intended and will be temporary. So we can look to a time when we're not going to have public health restrictions in place. We're always going to have public health recommendations, but the precise timing of that, which we'll all have to accept that timing could change, but we'll have more details on that in the near future.
From the Brandon Sun, Kyle.
Good afternoon. I know today that the province is no longer requiring daycares and early learning centers to notify close contacts. This follows something you put in place for schools in previous weeks. So I'm wondering, is there at a point where the province feels that they will return to this kind of contact tracing if, Omicron cases go down and if testing capacity is a little more manageable?
Yeah, so it's the nature of Omicron that has changed our approach. Having a virus that's so infectious with such a short incubation period makes the typical approach to contact tracing not effective. So it's really the nature of that Omicron that has made us change this. So if something should change, the epidemiology, a change in the virus characteristics, then we're always going to revisit, but we're always going to rely on effective measures going forward.
Thank you. And I also attended the trucker convoy freedom rally when I ran through Brandon on Tuesday. And I did speak to some people who, some of them were a little too far gone, but some of them were just kind of overall frustrated that we seem to be back to where we started the previous year, even though some of them have been fully vaccinated. And, they just feel like there's no progress being made. So I understand that the trucker convoy has its beef mostly with the federal government. But what would you say to people who are just frustrated with seemingly lack of progress that's being made on this front when it comes to mandates and vaccines and the like?
Yeah, so I've heard from a lot of those people in my constituency office inbox, as well as in my office here at the legislature, and our position as a government, and Premier Stephenson stated this earlier this week, is that vaccination is our way out of this pandemic, and having the option of rapid antigen testing or being able to produce a test to ensure that our supply chain is not heavily impacted by the decision that has been made. And in any discussions we're having with federal counterparts, even myself in my constituency, talking to my MPs, that is the position that I communicate, which is what Premier Stephenson has said, and we support that we certainly don't want our supply chain interrupted. And we're going through a very, very difficult time with the pandemic, and we certainly don't want it made worse.
From CJOB, Clay. From CJOB, Clay.
Okay, I hope you can hear me now. Dr. Roussin, some of the data suggests, or you said, looks favorable. So in a week, if that data continues to look favorable, can you paint a scenario how that could change the current health orders?
Yeah, and so I mean, it's our typical approach, right? We want to use, orders that are required to be used to help protect a acute care system. So as we see improvement in transmission and the indicators that we rely on, then our goal is always to loosen restrictions as soon as it's safe to do so. So right now we see some of this optimism. But it's not clear as of yet, or not as clear as we need it to be. And so that's why we're delaying that 1 week. So if we get more clarity on those indicators, then that's been our approach all along, is to loosen restrictions to a point that match the risk.
The UK has lifted its mask policy, but I believe a federal health minister suggested that even way down the law line, he suggests it probably is a good idea to continue wearing masks, even in the future. Would you agree?
So I think that when we're looking at restrictions, we're always looking at that risk and benefit, and so we know there are quite severe concerns related to health, mental health, with the restrictions as well. So we're always looking for that balance. So things like limiting, the freedoms of individuals, certainly having our kids out of school, restrictions on businesses and capacity have significant impact with that. So we definitely want to ensure we have the least restrictive means in that regard. I'm much more concerned with those restrictions than the requirement to simply wear a mask. I think that so it's something that we'll look at over time. But I think those other type of restrictions are certainly going to be the priorities to loosen as soon as we're able to do so safely.
Thank you.
From the Winnipeg Sun, Ryan.
Hi, thanks for taking the time. When you talk about indicators and using this week to kind of confirm the data, would expanding PCR testing eligibility not help paint a better picture so you can confirm that data?
With Omicron, no, I don't think it's going to make much of a difference for us. We saw from any of our previous waves, which with much less transmissible variants, that we're still missing a significant proportion of cases, right? We were diagnosing probably more like 1 in 4, 1 in 5 cases in other waves, and that was with widespread PCR availability. So right now, with the infectiousness of Omicron, we're going to miss a substantial amount of transmission. There's many asymptomatic individuals with or without expanded PCR. So right now, the testing is still important. It's very important for those who are at high risk and who could be eligible for treatment. And so we definitely want people to be tested if you're in that category as soon as even mild symptoms come up. But at this point, for surveillance purposes, that access to PCRs is not going to be able to give us much more information.
Okay, thanks. And how common are asymptomatic Omicron cases compared to other variants?
Well, we're still, learning about this, and that's a very difficult thing to get very clear information on. But it's certainly much more significant with Omicron than other variants.
From CBC Radio Canada, Emil.
Hi there. With the program that you've announced today to support families of transferred patients, are we to understand that you're expecting those transfers to last longer than expected?
So I do want to share that the transfer protocol has been in place in the health system, and Dr. Mateer may want to add further comments to mine, but has been in place for many, many years, and it's a clinical team that makes the decision in terms of transfers, and we want to ensure that an individual, once their acute care injury or situation has stabilized, that they are in the right facility receiving the safe and appropriate level of care, and it may not be in an acute care hospital, and so that has been in place for many, many years and is likely to continue.
Thanks. And just to add to that, Minister, the protocol is in place in order to be able to maximize the availability of acute care capacity to accommodate patients that require that level of care. And I think, as was mentioned earlier, the patients that don't require that level of care and could be cared for in another level within the healthcare system are those patients who are identified for potential transfer. And in doing so, then, as was commented earlier, then allow the healthcare system to accommodate improved access to those patients requiring acute care, and use healthcare facilities and the healthcare system more optimally to be able to deliver the right care in accordance with patient needs in the most appropriate environment.
All right, thank you. And are the facilities receiving the transferred patients still equipped to receive much more of them?
There's still capacity in the healthcare system for transfers. And we have daily calls in which we bring all of those stakeholders, all professionals representing each of those facilities and regions together to discuss patients who would be eligible for transfer. And so it's not so much as how many we can accommodate, it's how more appropriately we can care for patients within the healthcare system. And so we facilitate those transfers on a daily basis, and we continue to adapt the healthcare system to accommodate.
We now return to the news conference theater.
Dr. Roussin, we've gotten today, you've given us a preview on the hospitalizations and ICU numbers. How many deaths today?
We'll have our bulletin out that will explain that, yeah.
But you've got all the numbers and all the information today. This is the one number you're not giving us. We had 14 yesterday. What's the harm in telling us 35 minutes early?
Well, it's not the harm. It's just the bulletin was put together while I was in here. So.
And Minister Gordon.
Yes.
The stated PCR capacity for Manitoba is 4,000 tests. Now, you heard what Dr. Roussin said. We wouldn't learn that much more for more tests, but given the fact the province did contract BioCision Diagnostics, and we're doing just under 2,200 PCR tests right now, is there a cost savings component in not doing a few more PCR tests? Is part of the reason we're at 2,200 versus the stated capacity of 4,000 a decision not to spend that money?
No, it's a decision around what is optimal at this time, given the infectious nature of Omicron. So individuals, as Dr. Roussin mentioned, if they complete a rapid antigen test and test positive, still have access to PCR, a PCR test. So we're certainly not reducing access to that at all. And it's not about cost saving. It's ensuring that the tests that an individual needs when their positive is available, that the test that our healthcare system requires is available, and that is how the decisions are being made around testing.
Well, why not open it up like it used to be, where you could go, if you felt you had symptoms, you could go to a drive-through site, get a test, and then you'd know after isolating for 3 or 4 days, sometimes less, that you had a negative or positive PCR result.
So an individual can drive in and access a rapid antigen test now. And again, if they test positive, they have access to PCR. And so we're not limiting that access at this time.
Dr. Mateer, I was just wondering, you mentioned that this hospital stays for Omicron are less. I'm just wondering how you're able to determine that, or shorter, I should say, at the hospital level. Do you know when patients are in hospital, whether it's Delta or Omicron?
Well, yes, we do know, and we do record length of stay, and we're looking at, in terms of planning for the ability of the healthcare system to accommodate acute care and in ICU capacity. What we are looking at is the length of stay of patients within each of those sectors within the healthcare system, which would then determine the burden on the system. And for example, that's important when we look at modeling so we look at 2 points. One is admission to hospital and then occupancy in hospital. The other is admission to ICU and occupancy in ICU. And they're two different, and the difference between the two is essentially reliant on the length of stay of those patients.
Minister Gordon, does the province have any position on this recent federal exemption that's been asked for by the city of Winnipeg to decriminalize or legalize a small amount of certain substances for people in the city? Any position on that in terms of that conversation that's happening at the city council level?
I would refer you to Minister Guimard, who is the Minister of Mental Health and Community Wellness, on that question.
Patient transfers that's been going on for many years.
Yes.
That there's a protocol in place.
Yes.
Can you explain the difference between what occurred before the pandemic and what is occurring now in terms of the extent to which patients are being transferred, how far out of Winnipeg they're being transferred to, and to quantify that in some way?
I'll turn that over to Dr. Mateer.
Thanks very much for that. I think there were over 250 patients that have been transferred out of their home health region. And in terms of, and I think I heard your question right, I apologize if I haven't, around where those patients are being transferred to, that's less associated with the distance and more associated with the appropriate facility that can meet the needs of that patient. So the care needs are most important, and where they could be most appropriately cared for closest to their home base. And so those kinds of factors are taken into account when we think about that transfer protocol.
But you're transferring more now than you would pre-pandemic?
Well, we're having an intentional review of the acute care capacity, which means that we are specifically identifying patients who occupy a bed, for example, in the acute care facilities and system that don't necessarily need that level of care. And yes, more intentionally, we're looking at, particularly with the pressures of this pandemic, moving those patients to a more appropriate care environment.
But are there more now than would normally occur pre-pandemic?
More transfers there have been, yes.
Can you quantify
because it's
that?
a more intentional strategy.
Are you able to quantify that?
Well, out of this program, there's been more than 250 patients moved since we instituted the transfer protocol.
But how would that compare to pre-pandemic times?
Well, I haven't got those stats to hand, but I can say as a more intentional strategy, we are focusing more on transfers of patients out of the acute care system that perhaps would be more focus on that and therefore more transfers than there would have been without the pandemic pressures.
Minister Gordon,
Yes.
Can you explain why the financial compensation for families of patients who are transferred out of the region is not retroactive? That's 250 families who are going to be benefiting from the same compensation that people who are transferred in the future will have.
Well, it is effective today, and if there are patients that were transferred that are still outside of their regional health authority or their home base, they can their companions or their family members can access the hardship supports now, so it's available as of today and going forward.
Sorry, the press
Why
release said
not?
February.
But why not be retroactive though? Why not?
We'll take a look at that. It'll be a case-by-case basis. We are going to rely heavily on individuals being able to provide proof of their receipts and so very much evidence focused in terms of where they might have stayed, their gas, their meals. I'm not sure that anyone keeps that information for a long period of time. And in terms of the date, I will take a look at that. My understanding was it was effective today.
Minister Gordon, this is the fourth deadliest month of the pandemic so far in Manitoba in terms of COVID deaths. As health minister, your comments on the 140 odd people who've died from COVID this month?
It's tragic, and my condolences and my sympathies go to the family of the loved ones that have been lost in this pandemic. Every life is important. We don't want to lose life as a result of this pandemic, and that is why we're taking the steps that we are as public health, as a health system, to ensure that we're learning the lessons of the prior three waves and making changes to ensure individuals recover and are able to return to a good quality of life.
Given where we're at with the pandemic, I'm just wondering, Minister Gordon,
Yes.
given you're in charge of the health system, how comfortable you are with any potential loosening of measures, whether that comes, within the week or, maybe takes a little bit more time, just given where the health system is at right now.
So we're going to make informed decisions, and Dr. Roussin mentioned this, that we're going to look at the modeling. We are looking at, there are many tools in our basket in terms of addressing the pandemic through restrictions, wastewater results, what is happening at the federal level, what we're seeing across other jurisdictions. And so the decision will be very informed, but as Dr. Roussin said, the public health orders were always meant to be temporary. And we've always been looking towards normalcy and getting Manitoba back to a state, it may be a new normal, but certainly a state where we can carry out our lives. We can meet with our family members, travel and go to restaurants and all the things we enjoy about Manitoba, such as the arts that will be coming up this summer, the Jazz Festival, the Folk Festival, Folkorama, all the festivals that we've missed, and allow businesses to continue to be open and to be prosperous. So our focus is to make an informed decision, but we'll be looking at what's happening across many different sectors and not just one.
Minister Gordon?
Yes.
The federal government is distributing Paxlovid on a per capita basis. We know that Manitoba often has a higher hospitalization rate than other provinces. Do you think that distribution is fair, and have you asked for higher, like a greater amount of Paxlovid over a per capita allocation?
So my understanding was that we received about 1,100 doses. Certainly, if there's more available, that is handled through central services, and we're monitoring our supply and always asking the federal government for more supports in terms of the monoclonal antibodies. So we're monitoring and watching it very, very closely because it is an important tool in our fight against this pandemic.
She asked about Paxlovid.
The antiviral.
Yes. Oh, the antiviral. Yes, we continue to monitor the supply, and through central services, we're talking with the federal government about our supply and making sure that it's available. Yes.
Thank you very much.
Mhm.
Dr. Roussin, would you feel comfortable loosening restrictions if we're still seeing surgeries canceled and patients transferred out of their home populations to make space for COVID hospital patients?
Well, so certainly the strain on the acute care system is a big part of our decision making. So it's going to tie into a lot of things. So again, we're going to see where we're at with one more week, and and try to do so safely. So it's hard to mention just one specific thing like this, but certainly the strain on healthcare system is certainly the main focus of the public health restrictions to try to minimize that strain.
Okay, thank you very much, folks. Clock right now before I got to ask about the Jets.